Hello and welcome to Docplexus News. With more than 40 cases of coronavirus recorded in India, the Health and the Finance Ministries have stated that the government is working intensely to ensure effective interventions against COVID-19. Health tests at workplaces, universal screening of passengers flying from abroad, and setting up of additional screening labs are the precautionary measures being taken up to control the spread of the virus. The US FDA has approved a generic version of the drug Pyrimethamine for the treatment of toxoplasmosis. The drug is effective when co-administered with sulfonamides for treating toxoplasma infections that can potentially affect pregnant women, patients undergoing chemotherapy, organ transplant patients, and those with weak immune systems such as patients with HIV and AIDS. The drug is to be used cautiously in patients with impaired renal and hepatic functions, malabsorption syndrome, alcoholism, and folate deficiency. The US FDA has recently approved isatuximab in combination with pomalidomide and dexamethasone for the treatment of multiple myeloma in adult patients who were previously treated twice with therapies of lenalidomide and protease inhibitor. The approval is based on a clinical trial involving 307 patients with relapsed and refractory multiple myeloma and who were previously treated. The efficacy was based on progression-free survival in the amount of time the patient stays alive without the growth of cancer. The response rate was found to be 60.4% in comparison with the previous treatment response of 35.3%. The state of Gujarat has recorded 15,000 infant deaths in the year 2018-19. With over 1 lakh infants born in the state-run hospitals, more than 71,000 were admitted to the sick newborn care unit. In order to curb this devastating number of infant deaths, the government is taking steps that include priority appointments of pediatricians and medical officers, special training to doctors and nurses, and maintenance of adequate stock of instruments in the SNC units. As COVID-19 has spread across the world, India is facing a massive shortage of surgical and N95 masks. This has hiked the prices from ₹1 to ₹25 per mask, making it difficult for the hospitals to maintain stocks. Including India, several other countries including the US are also facing the similar shortage of surgical masks. To address this issue, the Maharashtra state government is likely to make interventions for regulating the mask prices. In the history of medicine, this day is remembered for the contributions of Eugene Lindsay OP in the research on the causes, transmission, and diagnosis of tuberculosis and immunization against the disease. His studies, based on morphological alteration in isles of Langerhans, emphasized the pathogenesis of diabetes and identified 2 forms of the parasite in bird malaria. The study reports about the life cycle of hematozoon parasite of bird malaria were considered amongst the author's best contributions. Docplexus salutes him for his contributions. Share your greetings by commenting below. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!